More.
How many? 1,814.
Mexican candy.
Me? This is the stuff I was telling you about.
Mexican
It's
candy.
sour. It's like salt and lemon powder.
I want to take a little bit and then like shot it.
Oh, it would be. I can't say nothing because at work, that beer salt, that lime beer salt, I just put some lime juice right on it.
What do you do?
I was thinking the same thing. Wait to the chat.
All right, 623. TDM means therapeutic drug monitoring. It is the measurement of drugs, and so when I say drugs, medications that are prescribed by medical providers. So not cocaine, okay, that's not prescribed by your doctor, not marijuana.
It can be prescribed by your doctor. Okay? No, marijuana.
I can drink it. Anyway, not, methamphetamines. Okay, that's not the drugs I'm talking about. I'm talking about, drugs that can be prescribed by your medical provider and their metabolites in body fluids, usually in blood, to maintain therapeutic benefits. The therapeutic range of a drug is the dose or concentration range of a drug within which the drug produces its desired therapeutic effect. So that means that's the dosage that the drug works. Okay? Because these drugs that we're about to talk about, if you don't give enough, then they don't what?
Work.
They don't work. If you give too much, it can be harmful. Okay, so that's why we have to monitor them. A drug therapy may lead to inefficiency or toxicity if its blood concentration is outside of that therapeutic range. Lab personnel play an important role in therapeutic drug monitoring because appropriate timing of the specimen collection, accurate measurement of drug concentrations, and timely reporting of results are critical to achieve safe and effective pharmaceutical therapies for patients. Most drugs are approved for use with recommended dosage regimens for patients who will achieve therapeutic benefits without the need of frequent adjustments of dosages. However, therapeutic drug monitoring is usually employed when a drug has a narrow therapeutic range or has mainly critical adverse effects. The main purpose of TDM is to ensure the correct drug dosage for the therapeutic range and identify drug-to-drug interactions if multiple drugs are taken together. Go down to the next paragraph. Therapeutic drug not the next one, sorry, the next one. Therapeutic drug monitoring may also be used to identify patients who are non-adherent or to re-optimize a dosing regimen because of drug-to-drug interactions or patients' physiologic changes that may affect drug concentrations at the sites of action. So go to routes of administration. To achieve optimal therapeutic benefit, a drug must be at an appropriate concentration at its site of action. Go down like 4 or 5 lines. Oral administration is the most common route of delivery, and it's less invasive for patients. Intravenous or IV administration via an IV drip or either an implanted venous access port offers the most direct and effective delivery to their site of action. Next paragraph. Some medications can also be injected directly into the muscle through intramuscular or IM injections, or either just under the skin with a subcutaneous injection. So whenever you go get your TB skin test, that is a subcutaneous, it's supposed to be, a subcutaneous injection. Others can be inhaled as an aerosol via a nebulizer, or can be absorbed through the skin, so transcutaneous or transdermal patch. Rectal delivery of a suppository is commonly used in infants. Or I know they have the dissolvable where you put it on your tongue like the Zofran, or in your cheek. But they also have that as a suppository too. Because I mean, obviously, if you're puking, you want some medicine somehow, right? So they do have that, for adults also. So drug absorption. When oral administration of drug is utilized, the efficiency of absorption from gastrointestinal tract depends on several factors. The disassociation from its administered form, the solubility in gastrointestinal fluids, and diffusion across gastrointestinal membranes. Tablets and capsules require dissolution before being absorbed, whereas liquid solutions tend to be more rapidly absorbed. Go 6 lines down. Because of gastric acidity, weak acids are efficiently absorbed in the stomach, but weak bases are preferentially absorbed in the intestine where the pH is more alkaline. For most drugs, absorption from the gastrointestinal tract occurs in a predictable manner in healthy people. However, changes in intestinal motility, pH, and inflammation, as well as the presence of food or other drugs, may dramatically alter absorption rates. So have you ever taken a medicine on an empty stomach versus eating? And there's different effects. Or we talked about the iron with what? Orange juice. Remember, orange juice doubles the absorption of iron. It says somebody was at my front door or my front yard, so I was trying to see who it was, but it was a bee flying in front of the camera. So I was like, who's in my house? It picks up like
Everything.
everything.
Like, I have a four-wheeler sitting in my backyard that has a cover over it, and if the wind
blows
over,
yep.
it picks that up.
If the wind blows my little flag in my front yard, my little garden flag, it'll pick it up. So ain't nobody come to my house about me knowing. For instance, a patient with inflammatory bowel syndrome may have a compromised gastrointestinal tract, so that may affect normal absorption of some drugs. Absorption can also be affected by co-administration of drugs that affect gastrointestinal function, such as antacids, fiber, kaolin, sucralfate, cholecystramine, and anti-ulcer medications. I took a medicine the other day. I can't remember what it was, but on the label it says do not take 2 hours before, 2 hours, something about after ingestion of antacids, or 6 hours after ingestion of antacids, or up to 2 hours before. And that's because it won't absorb it very well. Like, it's almost like taking a medicine and it not working, right? Because antacids can affect it. I can't remember what it was. Morphine may also slow gastrointestinal motility, thereby influencing the rate of absorption. Any type of narcotics influence gastrointestinal motility. I don't know if anybody's ever taken pain medicine in here, like after surgery or whatever, you become constipated. Okay, that's why it is horrible. But if you ever have surgery or whatnot, you have to take pain medicine. Make sure you take a like a stool softener with it, because if not, you're gonna run into problems. It does not feel great. Additionally, drug absorption rates may change with age, pregnancy, or pathologic conditions. Go to free versus bound drugs. 7 lines down, at a standard dose. The total plasma drug concentration may be within the therapeutic range, but patients may experience toxic adverse effects due to high free fraction or no therapeutic benefit due to low free fraction. These alterations in active fraction may occur secondary to changes in plasma protein content during inflammation, malignancies, pregnancy, hepatic disease, nephrotic syndrome, malnutrition, and acid-base disturbances. I don't care about the rest of that. Sorry. Turn the page to the next page. We're going to skip. I don't care about a drug half-life or drug elimination and all these calculations and stuff like that. We don't do that, okay? So turn to page 630. Second paragraph. Most drugs are not administered as a single bolus, but are delivered on a scheduled basis. So when it says scheduled basis, a prescribed dose of 100 milligrams is given once every 8 hours. That's how all medicine usually are given. The only time that you will get like a bolus or whatever is like IV fluids like saline or stuff like that, maybe at one time, okay? Like you get a whole bunch of medicine at one time. Now you might get like potassium chloride in with that IV fluid at one time, you know, like potassium and stuff like that. But as far as like medications, they're going to be given to you over time. With this type of administration, the blood drug concentration oscillates between a maximum level and a minimum level. The maximum level is called peak drug concentration, and the trough is the minimal level. You need to know that. So, we're going to talk about the different types of drugs in a minute. So remember when we were in micro and we talked about vancomycin? How is vancomycin given? By IV. Okay. So obviously you're in the hospital, right? Well, vancomycin is a pretty high-powered drug. Vancomycin, gentamicin, vancomycin, amikacin, all those, which we're going to talk about in a minute. So those are high-powered antibiotics. Well, in order for it to work, you have to get a certain amount, right? But then sometimes, based on your body's makeup, you can give a certain amount and have it scheduled. Let's just say that, we have vancomycin, we have a patient that is on vancomycin, and they are scheduled to get a dose every 12 hours. Fuming every, by the way, if y'all haven't seen that part. 12 hours, so every 12 hours. So let's just say they are scheduled to get a dose at 6 a.m. and 6 p.m. every day, like clockwork, okay? So, sometimes, because of their body's makeup, because of infection, like we just talked about, because of infection, because of inflammation, malignancies, pregnancy, hepatic disease, nephrotic syndrome, malnutrition, acid base, whatever they got going on, okay, it could alter how good or how not good that medicine works. Does that make sense? So, with that being said, considering this drug is pretty high powered, and you want to make sure that it doesn't cause damage, you're going to draw blood to check a peak and a trough. If a peak is 1 to 2 hours after a dose, so after their 6 a.m. dose, when would you draw their peak? Between 7 and 8 a.m. Then they're going to get a trough. When would you draw their trough? 4 to 5 p.m. Between 4 to 5 p.m. Okay. This is important for the lab. Okay, because the phlebotomist needs to know what time it's scheduled so that the phlebotomist can go and collect the peak and the trough. The peak right here, the 7 to 8 a.m., is the time that is 1 to 2 hours after a dose, so it should be at its what? Highest concentration, okay? Highest concentration. Is this, if you're giving it every 12 hours, okay, you're drawing the trough, that is the what? Lowest concentration, okay? Well, let's just say that a trough level is supposed for vancomycin. I'm just making up numbers. I don't know the rest of the time. Let's just say a trough level is supposed to be between 2 and 4. Okay? If you draw a trough and the trough level is 6. So the trough level is 6. That's high, right? So can that nurse give them that 6 p.m. dose? No. Because if she gives or he gives that dose on the levels that they have already, it's going to make them sick. It could kill them. Okay? So based on their lab results, or our lab results, they need to know what their peak and trough levels are, because they need to know whether to give the dose or hold the dose. Make sense? Yeah? So, most of the time they're critical, and you'll call them critical and whatnot, they'll hold that dose. Well, let's just say that a peak level is between 4 and 6. Okay? And after their 6 a.m. dose, their peak dose is 2. What might they need to do? Up their dosage, right? It ain't working. It needs to be between 4 and 6 for it to adequately work. Right after giving it, which is supposed to be the highest concentration, right? That makes sense to everybody? Yep, okay, any questions? All right. That's peak and trough. The goal of a multiple dosage regimen is to achieve trough and peak concentrations within therapeutic range. Evaluation of this function cannot be done immediately after initiation of the scheduled regimen, 1 to 2 hours after. After the first oral dose, this is talking about oral, absorption and distribution occur, followed by elimination. Before the concentration of the drug drops significantly, the second dose is given. The peak of the second dose is added to what remained from the first dose. Because elimination is first order, the higher concentration results in a larger amount of elimination. The third through the seventh scheduled doses all have the same effect of increasing the blood concentration and the amount of elimination. By the end of the seventh dose, the amount of drug administered in a single dose is equal to the amount eliminated during the dosage period. At this point, a steady state is established and the peak and trough concentrations can be evaluated. Go to specimen collection on page 631. Accurate timing of specimen collection is the single most important factor in therapeutic drug monitoring. Accurate timing, right? Because if you're going and collecting the specimen at 2 p.m., that tells us nothing, right? That doesn't tell us a peak and it doesn't tell us a trough. That is nothing. Okay, that's just a random dosage. In general, trough concentrations are drawn right before the next dose, and peak concentrations are drawn 1 hour after an administered dose. The peak level for IV administered aminoglycosides is 90 minutes after completion of the infusion, so that's why I said 1 to 2 hours. This rule of thumb must always be used within the clinical context of the situation. Drugs that are absorbed at a slow rate may require several hours before the peak drug concentrations can be evaluated. In all situations, the determination of drug peak concentrations should be performed only after a steady state has been achieved. So, what it's saying, too, with specimen collection, is if you're a phlebotomist, you know that you have the patient in room 212 that's on vancomycin, and you have to go collect them, you have to go collect the peak at 7 to 8 a.m., okay? That means you have to go collect that between 7 to 8 a.m., okay? So you need to make that a priority, you know? Does that make sense? So let's just say that you have random labs coming in or a random lab draw, but you have this one scheduled. Which one are you going to go draw first? The scheduled one and not those randoms. That makes sense? Because you have to get it at a certain time, okay? Go to the next paragraph. Yes, scheduled first before like random draws. Okay, let's think about it anymore. If a trauma comes in, which one are you going to get first? Trauma. They can hold off on that. You're going to get the trauma first, always, okay? Care must be taken that the appropriate container is used when collecting these specimens, as some drugs may be absorbed into the gel of serum separator tubes. So do you remember when we were learning our tubes, we said that a red top tube was, because a red has nothing in it, right? That the red was mainly used for therapeutic drug monitoring, okay, because it doesn't have the gel. Because some of the medication can be absorbed in the gel. And if the level of the medication, that's what you're measuring, right? If it's absorbed in the gel, then it won't be accurate. That makes sense? Wake up. It is necessary to follow manufacturers' recommendations to prevent pre-analytic error, and failure to do so may result in falsely low values. Calcium binding anticoagulants add cations that may interfere with analysis or cause the drug to distribute differently between red cells and plasma. As a result, EDTA, citrate, or oxalate tubes are generally considered unacceptable specimen types. However, there's one exception. EDTA whole blood is the specimen of choice for immunosuppressive drugs. But things like regular therapeutic drug monitoring, red top tube. Make sure you know that. Huh? Gold? Yeah, serum separator.
Oh, red is over like, I mean, that kind of hard.
One has a serum separator. So now let's talk about the drugs. Cardioactive. What do you think it has to do with? Your heart. Cardio. Cardioactive drugs are the most widely used medicines. Many types of cardioactive drugs have been developed to treat cardiac complications, and only the cardiac glycosides and antiarrhythmics frequently involve therapeutic drug monitoring practice to avoid their serious adverse effects. Digoxin. It is a cardiac glycoside used in the treatment of cardiac arrhythmias and congestive heart failure. The next part right here, what it's saying is that it has to be checked, the levels have to be checked, because the side effects, it can cause cardiac arrhythmias. And what is it supposed to treat? Cardiac arrhythmias, right? So that's why we have to monitor it, okay? Not the next paragraph, but the next. Because of the narrow therapeutic range, establishing a dosage regimen of digoxin usually requires assessment of blood concentrations after initial dosaging to ensure that effective and non-toxic plasma concentrations are achieved. Quinidine. Is another one. Quinidine is a natural product extracted from the bark of a fever treat. It's used to treat cardiac arrhythmias. Next page. Propanamide. Guess what it's used to treat?
Cardiac arrhythmias.
Cardiac arrhythmias. You can be familiar with disopyramide, which is also called Norpace. That's the brand name. It's another anti-arrhythmic drug. Okay, so those are your cardioactive drugs. Antibiotics. Aminoglycosides. Which are gentamicin, tobramycin, amikacin, kanamycin. So aminoglycosides are a group of antibiotics used to treat gram-negative and some gram-positive bacterial infections. There are many individual antibiotics within this classification, and the most frequently prescribed aminoglycosides, gentamicin, tobramycin, amikacin, and kanamycin. They inhibit bacterial protein synthesis, but vary in effectiveness against different strains of bacteria. The blood concentrations of aminoglycosides above the therapeutic ranges can cause serious toxicities, especially nephrotoxicity. So it's toxic to the what? Okay, and ototoxicity, which is what? What's oto? Huh? Here. Yeah. Aminoglycosides can disrupt inner ear, cochlear, and vestibular membranes, which result in hearing and balance impairment. The ototoxic effects are irreversible and may be seen with repeated high-level exposures. Nephrotoxicity is also a major concern for patients with this type of antibiotic therapy. It can essentially cause renal failure. Go to the next paragraph. Aminoglycosides are poorly absorbed in the gastrointestinal tract, and their administration is limited to IV infusions or IM injections. Therefore, these drugs are not used in an outpatient setting. So if you are getting any of these campaigns, you are in the hospital, okay? So gentamicin is an antibiotic used to treat life-threatening blood infections caused by gram-negative rods, particularly Enterobacteriaceae, Acinetobacter, and Pseudomonas species. It's also used in combinations with Staph aureus. Tobramycin. Tobramycin is an antibiotic used to treat Bactrimia septicemia, by gram-negative rods, including Enterobacteriaceae and Pseudomonas aeruginosa. Amikacin, same thing. Severe blood infections by susceptible strains of gram-negative bacteria. It includes bacterial death by binding bacterial ribosomes to inhibit protein synthesis. And then now, vancomycin. Vancomycin is a glycopeptide antibiotic against gram-positive cocci and bacilli infections. So all the other ones, all of these, were kind of were geared to gram-negative. Vancomycin, gram-positive. Okay? Because of its poor gastrointestinal absorption, vancomycin is administered by IV infusion and reaches peak concentrations 1 hour after dosing. Plasma protein binding levels of vancomycin is approximately 55%. The pharmacodynamic properties of vancomycin have not been firmly established. Many toxic effects occur when the concentration exceeds the therapeutic range. And it was 10 to 20. I made up 2 to 4. Okay, 10 to 20. Now, anti-epileptic drugs. What is an anti-epileptic? Which is to prevent seizures. Anti-epileptic drugs are used to treat seizure disorders and to suppress seizures, but are only effective while the drug metabolites are in the body. So, primidone. Primidone is used for the control of grand mal seizures that are refractory or resistant to other anti-epileptic drugs. Phenobarbital. Phenobarbital is a slow-acting barbiturate, underlying barbiturate. That controls several types of seizures. So, we haven't gotten to that part yet, but in your drug screening, did y'all pay attention to your drug screen? No, you didn't. Yeah. Knowing you're not on anything, but you're looking at every one of them, see and make sure.
That's actually in there.
Like the common, so we haven't gotten there yet. We're going to, you have like your opiates, THC, you have MDMA or ecstasy, you have, methamphetamines, you have amphetamines, you have barbiturates, you have benzos, okay? So all of those go into a class. Well, opiates are like, your main, pills, like, like oxycodone and hydrocodone and stuff like that. Okay? Painkillers, yes. THC, marijuana, right? MDMA amphetamine or meth, methamphetamine. Amphetamine is, Adderall, okay, pretty much. Barbiturates, they're downers, they bring you down. So that's sometimes what people take. Benzos are your, like sleeping pills and stuff. Okay, so it's categorized. Well, phenobarbital is a seizure medication that doctors prescribe for seizures. Okay, so you can measure a phenobarbital level by itself, right? But then, let's say you have to have a drug screen, like y'all just went to. If you were taking phenobarbital for seizures, you would be positive here. Does that make sense? Is this a barbiturate? That makes sense? Okay. So you can measure the level by itself for therapeutic drug monitoring, okay? But then some people illegally, okay, take it to bring them down. It's a down. So, okay, that's why it's in a drugstore. It's because people abuse it. This is drugs of abuse. Okay, these are therapeutic drugs. Make sense? Okay. Anyway, phenobarbital technically is for seizures. You have phenobarbital, you have pentobarbital. When dogs have to go to doggy heaven and get put to sleep at the vet, that's what they're given is pentobarbital. This is a form kind of this, and basically just and they go to doggy heaven. Okay. Anyway, the next one.
Make sure he was good.
Is phenytoin, which you also need to know as Dilantin. You will see it ordered both ways. Dilantin is like the name brand. Yes, either. Dilantin is the name brand, okay? Kind of like Tylenol is the name brand for acetaminophen. Or Motrin is the name brand for ibuprofen, or Bayer aspirin is the name brand for aspirin, or Aleve is the name brand for salicylate. Okay, Dilantin is the name brand for phenytoin. So this is what's being measured, but a doctor might write Dilantin. That's the name brand. Does that make sense? So you need to know both.
Well, we didn't know that. And the doctors do all this stuff.
Oh, GTS, yes. You know what that means? Google that shit.
I mean, I was
That's
just
what that
making
means.
here because,
GTS. That is exactly what that means. Yes. I've had to, where I've forgotten sometimes, they'll put Dilantin, and so you're seeing these that you can order, like these names. You're like, Dilantin, what that means. Oh, that's beautiful. Okay.
I was just making
Yes.
sure like we went on this.
So phenytoin or Dilantin is used for seizures. Valproic acid is another. And you need to know that it is also called Depakote. It is used in the treatment of petit mal and absence seizures. This is the one I always forget. Which now I don't, because Ellicott got put on it for her leg disorder. Carbamazepine, also known as Tegretol. It is for seizure disorders, mainly. It's apparently also for myasthenia gravis. That's what they use for, huh? For what? The next one that you need to know is gabapentin.
Don't they use it for round block too?
Okay,
because I take that.
It don't work.
Yes, it
Don't work. So gabapentin is also called Neurontin. No, it's not a drug of abuse. Not a barbiturate. Therapeutic drug.
I know, they did it, man, they don't got this bitches on every day.
Lyric takes Lyrica.
But they use it as a nerve block for my brain.
For coagulation studies, not chemistry. So gabapentin or Neurontin is administered orally with a maximum bioavailability of 60%, which is reduced when antacids are administered concurrently. This drug may be administered as a monotherapy or in conjunction with other patients suffering from other seizures, with or without, or partial seizures, with or without, and for pain management in some scenarios. Story time. So, when I had my hysterectomy, they come in there for pre-op, and, were giving me all my medicines before surgery. And, they're supposed to tell you what medications they're handing you. That's kind of a double check type thing. A lot of people go, all right, give it to me, because they don't know what medicines they're getting. They don't have a medical background. But me, I know a little bit about medication. Okay, not all of them, some of them. And so she's like, she gave me Tylenol. This is your Tylenol, it's for pain. And then she goes, this is your gabapentin. Like, this is your gabapentin, this is for pain. And, or no, she didn't say for pain, she's like, this is gabapentin. And then she's like, this is something, and I said, oh. I said, wrong patient. And she's like, ma'am? I was like, I don't have seizures. Because that's what I always think with gabapentin is seizures. I was like, I don't have seizures, that ain't mine. Because she was mainly administering like my home meds before surgery, like, you're not supposed to take any medicine until you get to the hospital. And then like stuff before surgery, like Tylenol, eventually the Versed that makes you loopy, blah, 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 blah. But then she was like, and I was like, hold on, that ain't mine. And she's like, no, the doctor ordered it. I was like, he ordered it wrong. Well, that's not mine. I don't have seizures. And she started laughing. And she's like, no, it's used also as like a nerve block, like a pain medication too. I was like, oh, okay, well, you give it to me. Because I know about the being, and I was wrong. That is the right thing. Works so good. I've ever had in my life. Mhm.
I was like, how you guys know what it is? I was like, what's this for? He was like, oh, no. It's like, it's for,
It's a Z-Pack, yeah.
Yeah.
Well, that's kind of like, a lot of times they'll put you on, oh darn, Flagyl for parasitic infection. And, my husband come home and, he don't know medicine, but he's like, it was whenever he was having like major diarrhea, like for a week, like over a week. And he's like, what's Flagyl for? They put him on two different ones. He's like, what's this Flagyl for? I said, well, two things. Either they think you got a parasite or they think you got C. diff. I was like, so I said, or, possibly an STD. I don't know, like that. He's like, and I was like, "Hey, it's just something, you're fine. It's not for that, I was thinking. I mean, it is for that, but not in this case. But anyway, so gabapentin is also used for pain management too. Okay. Another one. Never remember how to spell it. Lamotrigine. It is also known as Lamictal. And trust me, they're gonna put Lamictal over the Lamotrigine any day. So that's the time you always have to look that one up.
Everybody's knows it's bigger than 20.
Oh, people hurt, yes. Right? Or no?
Is that a R or a V?
LED. It's easier to outline it like this, because trust me, this is what you're gonna have to do. So you gotta think, cardioactive is for your heart. Antibiotics, obviously, that's serious. Anaphylactic seizures. Because we're not worried. This is what you're gonna need to know. And obviously what anti-elliptic means. So levetiracetam, also known as Keppra. Goodness. Right here. Go down 3 lines in that one. It is used in partial and generalized seizures. Just 3 lines down from the first one. Carbazepine. Yes.
And we need to know both terms.
Yes. That's why I'm writing it like this. It's also known as Tourette. You on all three?
You sure?
Well, no, because she, the patient is, the patient is, 13 grand on each.
Topiramate is Topamax. It is used for seizures. And I want to say that this can also be used for migraine headaches.
Yeah, I think I was on that.
Mhm. Migraine is also. That's a bunch of that one.
Alright, so basically, what exactly are we need to know? Just what group they fall under and then that.
And what they, how, what they mean, what they do.
But I mean, like, see,
Right.
that's,
Yeah. Psychoactive. What do you think psychoactive is? Psychotic drugs. Absolutely. Lithium. Is one.
So that's, they use lithium batteries.
That's the main thing.
I know, that's what I'm saying, psycho.
Everybody in the county knows that, Lord.
Why do you think they put a limit on it? Batteries are super.
That is true.
You have to have your license to get stupid out of the family dollar. You have to be 18 and older.
For the people hooking the Sharpies.
Yeah. And paint.
Hooking it? It makes you high? Oh, just to sniff it. Well, remember they used to have the Sharpies that, like, had like a smell, like fruity smells to them or whatever. And then they realized people were hooking them, like, to get high. And then they were like, yeah, maybe we shouldn't do this anymore. Yep. Oh, you remember the glue? I don't know if they can sell it anymore. The glue in the brown glass thing that you screwed off and then it was the little paintbrush thing.
They still have.
They still sell it? Yes, so y'all don't know what I'm talking about? It's a brown, usually a brown bottle. And then it's glue.
They have it over at.
And it's a screw, whenever you take it off, it's got like a paintbrush thing attached to it. So you use it for big areas. Kind of like a big glue stick,
But
but
now
works
they got
better.
little cotton balls on them and they're for like tops and stuff. But did you put the glue on
Oh,
there?
yeah, no, but they had that for like paper.
Like Elmer's?
Yeah. Yeah, I think it used to be like Elmer's glue.
They still
I
have
know,
it.
you can smell it, like. But one day I went to buy that, I was self-checkout and I was like, I'm like, how to buy glue? Like, and so then I asked the girl, this was, a long time ago. I asked the girl, I was like, why do I have to get carded to buy glue for a project?
That stuff?
Yeah,
Oh, rubber cement? Yeah.
and, she's like, because kids are like hooking it. I was like, you don't think 19 and 20-year-olds have it too? I'm just curious.
I have seen something like that, but I don't think it was blue. There's another can that has something like that. Is it like the metal can? That's the pipe.
Yeah, they
Okay, that's
have,
what I'm thinking.
yeah.
Got a little cotton ball on the end of it.
yeah, that's
Yeah.
for like PVC pipe, yeah.
Okay. Got a picture of 22. That seems big. Wait,
I know.
wait.
So psychoactive drugs, lithium. Lithium is a mood-altering drug primarily used in the treatment of bipolar disorder, recurrent depression, and aggressive or self-mutilating behavior.
That's why it's tricky.
Though it may also be used as a preventative treatment for migraines or cluster headaches.
I watched a Netflix show about this.
About lithium?
Well, it's a show about a girl that skates, like ice skates, but she has to take that, like it's about her and her like
Mental health?
yeah. It's kind of weird and the language is different, but I mean, I just love it. Sometimes.
Tricyclic antidepressants. Yes. They are a class of drugs used to treat depression, insomnia, extreme apathy, and loss of libido. Oh, stop.
Zero chill.
So those are also in the drug abuse category too. Where if you have a drug screen, they'll screen you for that also. Depending on what class you get. Clozapine is the next one. No, if I don't write it up there, don't worry about it. Clozapine is an antipsychotic used in the treatment of refractory schizophrenia. Kim's gone, but you and Kim. Oh, and I think Hazelhurst.
They're
might-
doing too. Psych ward.
They have behavioral health units.
Dude, I think that's so cool. I didn't say that.
So
I don't
you're
really have
gonna, get to experience people that are on KIFRA and on TCAs and stuff like that.
We don't
That's
have
what
a
it is.
behavioral health unit, but I've had my fair share.
I got fit there.
Trying to draw blood from a man, he gunned me.
With his one sharp ass. Well, at least. He goes. All right, immunosuppressive drugs. So immunosuppressive, what does it do? Suppresses your immune system. Transplantation medicine is a rapidly emerging discipline with clinical medicine. The clinical laboratory plays many roles in transplantation programs. Among these responsibilities, monitoring of immunosuppressive drugs used to treat organ rejection is a key concern. Most immunosuppressive drugs require establishment of individual dosage regimens to optimize therapeutic outcomes and minimize toxicity. The first one, cyclosporin. We have talked about that. Yep. And for bone marrow and all that good stuff. Cyclosporin is a cyclic polypeptide that has a potent immunosuppressive activity. Its primary clinical use is suppression of graft versus host rejection of heterotrophic transplanted organs. The next one is capsulosis. It is an orally administered immunosuppressive drug that is 100 times more potent than cyclosporin. Another one. It is an antifungal agent with immunosuppressive activity that is used to prevent graft rejection in patients receiving a kidney transplant. I don't really care about those. Well, I was gonna take a picture of it.
The rest of those ones, don't bear, don't bear. I can't see y'all.
Anti-neoplastics. You don't know what this one is. Unless you read. Huh? You said plastic surgery? That's what I'm saying.
And the first one, oh, shit, hold on. That's not it.
There's only one anti-neoplastic. Okay, Damon could tell you what that's for.
I put on that before.
Yeah.
Yeah, for like, right. But
Yeah.
reading it, I don't really understand why.
So methotrexate. Well, go back to anti-neoplastic, sorry. Assessment of the therapeutic benefit and toxicity of most anti-neoplastic drugs is not aided by therapeutic drug monitoring because their pharmacodynamics are hard to establish. Most of these agents are rapidly metabolized within seconds to minutes of administrations. In addition, therapeutic ranges for many of these drugs include concentrations associated with toxic effects. So methotrexate. It is one of the few neoplastic drugs in which therapeutic drug monitoring may offer some benefits to determine a therapeutic regimen. High-dose methotrexate followed by leucovorin rescue has been shown to be effective therapy for various neoplastic conditions. We've talked about neoplastic before. Some forms of anemia. Yeah. Not just iron deficiency anemia. Okay. This therapy involves the relative rate of mitosis of normal versus neoplastic cells. In general, neoplastic cells divide more rapidly than normal cells, and methotrexate inhibits DNA synthesis in all cells. Neoplastic cells, which rapidly divide, have a higher requirement for DNA and are susceptible to deprivation of this essential constituent before cells. Go down. Six lines down. So this, I will say about methotrexate, can be given orally. Injection, no, not an injection, infusion. Maybe it can be given as an injection too. Or an infusion. My mom takes 9 methotrexate pills every Friday. So go down to 6 lines, I think. Failure to stop the action of methotrexate results in cytotoxic effects to most cells. Evaluation of serum methotrexate concentrations after the inhibitory time period has passed is used to determine how much leucovorin is needed to counteract many of the toxic effects of methotrexate. Go to the next paragraph, then go up before bronchodilators. And you see where it says the renal system, just highlight that. It's bad on the kidneys. It's taking too much. So, methotrexate can be used for several different things. It is a cancer drug. It is a drug for autoimmune disorders. So my mom has rheumatoid arthritis, so that's why she was on it. Yours with psoriasis, autoimmune. So is end stage leukemia better? Probably for the leukemia. So cancer.
Like I was sick all the time.
Yeah, mama gets super sick every time she takes it.
I had to take 6 every day. I don't know.
Well, she did that. That's how she was, but then she's not compliant. I'm gonna call that up. So then bronchodilators. I wasn't sure if it was dilators or dilators. What does it do? Ooh. That's a different type of dilator.
No, laters, where you guys laters thing?
Oh, I thought you were talking about something else. You were talking about 50 Shades of Grey.
Like how he pronounces it, laters.
Oh, oh,
Well,
okay.
ew. Well, I probably heard that.
Yes. Okay. It dilates your bronchioles of your lungs. So, theophylline. Theophylline is used in the treatment of respiratory disorders such as asthma and stable COPD for patients that have difficulty using an inhaler or those with nocturnal symptoms. I'm going to add one more to this that is not in your book. You have bronchodilators. Vasodilators. And usually, this doesn't necessarily have to be monitored, but nitroglycerin. Does anybody know that's water? It is for your heart. When you're having a heart attack, heart attack. So the first thing that you're gonna get when you get to the hospital and you're having chest pain, like true chest pain, and it's heart related, you're gonna get aspirin and nitroglycerin. They're under the phone. And that's this chapter. It's not really too bad, but at the same time, it's a lot of drugs.
That's a lot to spell. It's Cardizem. What's Cardizem? I know, well.
Partisan, is when your blood pressure is really, really high, or your heart rate is really, really, really high. Yeah, usually, when you're like an atheist, they'll put you on a partisan trip. That's what, they put Patrick on. And, then all of a sudden, of course, he was on it, and his blood pressure bottomed out real quick, and then they had to take him off.
I think nitro, don't it have like weird looking tubing?
Let's go to the next chapter, toxicology. Gonna kind of be an overview one too, pretty much. Page 651. Alcohol. So the toxic effects of alcohol are both general and specific. Exposure to alcohol, like exposure to most volatile organic solvents, initially causes disorientation, confusion, and euphoria, but can progress to unconsciousness, paralysis, and possible death with high-level exposure. So, there are different types of alcohols. So let's look at ethanol. Ethanol is like the main alcohol, okay? Which is the alcohol we drink. Okay. Ethanol. So make a note or alcohol in general is the most common drug of abuse. Because where the other drugs of abuse are illegal, pretty much, alcohol is legal. So ethanol exposure is common, and excessive consumption with its associated consequences is a leading cause of economic, social, and medical problems throughout the world. Excessive drinking was estimated to cost the U.S. $249 billion in 2010. Many social and family problems are associated with excessive ethanol consumption, and the burden to the healthcare system is significant. Turn to the page. Go to, not the next paragraph, but the next. Besides the short-term effects of ethanol, most ethanol abuse is associated with chronic consumption. Chronic consumption has been associated with compromised function of various organs, tissues, and cell types, but the liver appears to be affected the most. Obviously, leads to cirrhosis. So methanol. Methanol is a common lab solvent that is also found in many household cleaners. Go to isopropanol. It is known as rubbing alcohol. Ethylene glycol, I said this the other day, it's a common component of hydraulic fluid and antifreeze. Turn the page. Carbon monoxide. The primary environmental source of carbon monoxide includes gasoline engines, improperly ventilated furnaces, and wood or plastic fires. Carbon monoxide is a colorless, odorless, tasteless gas that is rapidly absorbed into circulation from inspired air. It says it's odorless, but like I can smell carbon monoxide. Like, you have never smelled like it coming out of your car? Like you're in a garage or something? I don't know, I don't know if it's the carbon monoxide I'm smelling, or if it's like the gas, yeah, but like you know it's coming from that, you know what I'm saying? When carbon monoxide binds to hemoglobin, it is called carboxyhemoglobin. Go down right before table 26.3, or actually after in the reading where it says table 26.3. The only treatment for carbon monoxide poisoning is 100% oxygen therapy. And if you have true carbon monoxide poisoning, they're going to put you in the hyperbaric chamber. Y'all remember talking about the hyperbaric chamber? Diabetics can go and get in the hyperbaric chamber it's for wounds.
Like healing
Yes, healing of wounds, because remember, oxygen helps circulate and growth and stuff like that. So, but you're gonna get in the hyperbaric chamber. Okay. Cyanide. It's classified as a super toxic substance that can exist as a gas, solid, or in a solution. Because of the various forms, cyanide exposure can occur by inhalation, ingestion, or transdermal absorption. Cyanide is used in many industrial processes and is a component of insecticides and rodenticides. I don't know that it has. I don't know that it has cyanide either. Metals, turn the page, metals, arsenic. Go down, I don't know, 10, 11 lines. It says arsenic is a common homicide. Y'all see that? Arsenic is a common homicide and suicide agent. Ingestion of less harmful organic forms of arsenic can occur with foods such as clams, oysters, scallops, mussels, crustaceans, and some bottom-feeding fish. Go to 657, lead, 3 lines down. It was a common constituent, or it is a common constituent of household paints, technically, and is still found in commercial paints and art supplies. Go over to that paragraph, straight across to that paragraph. Lead toxicity is multifaceted and occurs in a dose-dependent manner. Abdominal or neurologic symptoms manifest after acute exposure only. The neurologic effects of lead are particularly important. In which group of people? Kids, absolutely. Go to the next paragraph. Since children are more sensitive to these effects than adults, childhood lead testing is mandated in 11 states, and Georgia is one of those states, and for all children enrolled in Medicaid programs. You do a lead at 1 year old and 2 years old. The normal threshold for blood lead levels is set by the CDC, and it's 3.5. Growth deficits are seen in children with lead levels greater than 3.5, and anemia may occur at lead levels of 20. I've seen anemia occur in lead levels a lot lower than 20 also. Turn the page. I think this is meant to say more, not less. A blood lead level more than 3.5 has been reported to suffer from permanent IQ and hearing deficits, not less, more, because the threshold is 3.5. More than 3.5, not less. So as a result, many states have lowered the upper limit to 5. So if it is greater than 5, we need to absolutely do something about it, okay? It causes severe neurologic mental retardation in children and anemia. What's one thing you could do for a lead? What's one way to get rid of it? You can also do the same with iron.
Like take blood out, what's that called?
Chelation.
Chelation.
Not therapeutic phlebotomy, chelation. You might be thinking of therapeutic phlebotomy. The phlebotomy is literally taking the blood out and just throwing it away.
But the other is you take it out and like,
Like
and then
dialysis.
put it
Yeah,
back in.
yeah. Also make a note that you are going to, draw a lead level with a tan top tube. Tan. I don't know that we went over tan in your stuff. It is a tan top tube. What, this goes back to hematology. When somebody has lead poisoning, what's one hematologic finding that you see? Yeah, what's that called? Basophilic stiffling. Yep. And it's actually, if you go over, like from the last part that we highlighted, go over. You go 4 or 5 lines down. Basophilic stiffling in erythrocytes.
Well, it says it right there that paragraph, well, it says it's been identified, basophilic stiffling in your blood clot.
Yeah. But it causes severe neurological effects over 5. Turn the page. Toxicology of therapeutic drugs. Salicylates. Acetylsalicylic acid, or aspirin, is a commonly used analgesic, antipyretic, and anti-inflammatory drug. So acetylsalicylic acid, that is aspirin. Go down to the very last sentence of this paragraph. There is also an epidemiologic relationship between aspirin and childhood viral infections and the onset of Reye's syndrome. Acute ingestion with high doses of aspirin is associated with various toxic effects through several different mechanisms. Because it is an acid, excessive salicylate ingestion. So, people try to kill themselves by taking aspirin, right? Y'all heard of that? Okay. Excessive aspirin ingestion is associated with metabolic acidosis. We just talked about that. Salicylate is a direct stimulator of the respiratory center, and hyperventilation can result in respiratory alkalosis. In many instances, the net result of the combined effects is immediate mixed acid-base disturbance. Salicylates also inhibit the Krebs cycle, resulting in excessive conversion of pyruvate to lactic acids. In addition, at high levels of exposure, salicylates stimulate mobilization and use of free fatty acids, resulting in excess ketone formation. Underline that. So if people take a lot of acetylsalicylic acid, aka aspirin, it results in excessive ketone body formation, and it will contribute to metabolic acidosis and lead to death. That's why people use it as a suicide drug when taken in large quantities. Acetaminophen is Tylenol. Turn the page. The second paragraph. Oh, wait. Sorry, right before that. If you overdose on Tylenol, it results in a toxic effect to the cell, leading to necrosis of the liver, which is the organ in which this reaction occurs. You will go into liver failure, necrosis of the liver, liver death. So people use that as a drug of abuse. Now the next, toxicology of drugs of abuse. Assessment of substance abuse is of medical interest for many reasons. In a drug overdose, it is essential to identify the responsible agent to ensure appropriate and timely treatment. Go down to drugs of abuse, DOA. Know what DOA stands for. Not only does it stand for dead on arrival, like in the ER, DOA, dead on arrival, it also stands for drugs of abuse in the lab. Go to amphetamines. Amphetamines and methamphetamines are therapeutic drugs used for narcolepsy and attention deficit disorder. Okay, let's back up. Amphetamines is drugs used for narcolepsy and attention deficit disorder. Methamphetamine is man-made, okay? These drugs are stimulants with high abuse potential, and they produce an initial sense of increased mental and physical capacity, along with a perception of well-being. These initial effects are followed by restlessness, irritability, and possible psychosis. That's why you see which I haven't seen him in a while, I wonder where he's at. Might be. But the guy in Vidale walking around that, I call Rock Kicker, because he walks around, he does it a lot better. But he literally walks around Vidale, he's so high to the fire, and looks like he's kicking or something. And he bends down and starts talking stuff. He's going through psychosis because he's high on this. Six lines down. Various compounds chemically related to amphetamines are components of over-the-counter medications, including ephedrine, pseudoephedrine, and phenylprophenylene. These amphetamine-like compounds are common in allergy and cold medicines. That is why you cannot buy true Sudafed, you have ephedrine, okay? And then you have pseudoephedrine. Pseudoephedrine is your Sudafed that is sold over the counter. Ephedrine, true ephedrine, you have to buy with the pharmacist because people are using it to make meth, okay? Sedatives and hypnotics. Many therapeutic drugs can be classified as sedatives, hypnotics, or tranquilizers, and they're all members of the CNS depressants. Go down 4 lines. Barbiturates and benzodiazepines are the most commonly types of sedative hypnotics used. Go to barbiturates. We just talked about this. They represent a class of drugs that were originally introduced as sleep inducers. Sleep inducers, so the puppy that goes to sleep and then goes to heaven, okay? Sleep inducers. Secobarbital, pentobarbital, and phenobarbital are the more commonly abused barbiturates. These drugs are commonly abused as downers to induce sleep after an amphetamine or cocaine-induced high. So they get woohoo on amphetamine and methamphetamine and cocaine, and then they are up for 5 days, and then they'll take barbiturates to go to sleep. Okay, it's sad. So sad. Benzodiazepines. They're a group of compounds having a common molecular structure and acting similarly as depressants of the central nervous system. Go down 4 lines. They are in high public demand for sedative and anti-anxiety agents. Diazepam, which is Valium, lorazepam, which is Ativan, and alprazolam, which is Xanax, is the most commonly abused benzos. Cannabinoids, tetrahydrocannabinol, THC. Yes, you need to know how to spell it. Cannabinoids are a group of psychoactive compounds found in marijuana. Of these, THC is the most potent and abundant. Marijuana, or its processed product, hashish, can be smoked or ingested. With this, I'm just gonna, it's not in here, but I'm just gonna point this out. So in Georgia, y'all heard of Delta 8 and Delta 9? You can buy them at the vape shop, okay? it literally smells just like THC, true marijuana. It has like 0.01% or 0.01002%, depending on what brand you get. In Georgia, it is legal because it contains like a very, 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 very minute amount. With that being said, a lot of people smoke it or take gummies or whatever, like for anxiety, kind of like the CBD, anxiety, pain, puts you to sleep, stuff like that. So in Georgia, it's legal, and just on a screening test, it can pop up positive for THC. However, if you do it as a send out and you do like liquid chromatography, mass spectrophotometry on it, it'll break it down to where it'll say, hey, this is not true THC. My kid and my husband did not stop this. But with that being said, even though it's legal in Georgia, there's a fine line. A lot, especially private companies, privately owned companies, let's just say HCA, for example, has a no drug policy at all. So even if you were smoking that, even though it's legal in the state of Georgia, they say no. And it can get you fired from your job. So if you are taking, even though it's legal technically, and it's like 0.001% THC, if you pop positive for any reason, you can ask them to send it for confirmation, and they may accept it, but they may not, because Georgia is a state that you can get fired for breathing wrong. You don't have to have a reason for them to fire you. You don't have to have a cause. As long as they don't discriminate against you, like on the basis of color, sexual orientation, blah, 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 gender, pregnancy, stuff like that. As long as they don't discriminate against you, they can fire you just for breathing wrong. Okay? That's Georgia for you. So just put that in mind. Cocaine. Cocaine is an effective local anesthetic with a few adverse effects at therapeutic concentrations. At higher concentrations, it's a potent CNS stimulator that elicits a sense of excitement and euphoria. Cocaine is an alkaloid salt. It can be administered directly by like injection or inhaled as a vapor when smoked in the free base form known as crack. Everybody's heard of crack cocaine, right? Acute, go down a little bit. Acute cocaine toxicity is associated with hypertension, arrhythmia, seizures, and myocardial infarction. I don't know how many 30-year-olds that you get in the ER that have had a heart attack. You do a drug screen on them, and they have cocaine in their system. It's a bunch. You'd be surprised. They go on cocaine bingers, and they have heart attacks, and they'll come in, and you're like, oh my God, they're having a heart attack. You treat the heart attack, and then you're like, you're 30 years old. What's going on? You're this thin. Why are you having a heart attack? I could understand if you're 500 pounds, because you probably got some plaque buildup having a heart attack, right? But if you're this thin, why are you having a heart attack? So they might do a drug screen on them, and they'll see that they have cocaine in their system. Go to opioids. Opioids are a class of substances capable of analgesia, sedation, and anesthesia. All are derived from or chemically related to substances derived from the opium poppy. So Other thing, poppy seeds that you eat on bagels. You can pop positive for opiates. That's wild. You can. Poppy seeds, like on bagels and stuff like that. If you eat a bunch of them, you
It
can.
takes a good bit.
So it's not like you eat a bagel and then they'll go to.
You can pop positive for opiates.
Eat it like every day.
I mean, I don't eat a bunch.
Turn the page. The opiates included opium, morphine, codeine, heroin, hydromorphone, which is Dilaudid. I was like, gross stuff. And oxycodone. That's like gross stuff. Are chemically modified forms of naturally occurring opiates. Demerol, methadone, Darvon, Pentazocine, never heard of that, and fentanyl are also common opioids. Okay, so has anybody heard of morphine for pain? What about codeine for pain, or either codeine cough syrup? People make lean from codeine cough syrup. Yes. Heroin. We've all heard of heroin, right? Heroin is mainly because people get put on pain medications. And then obviously, you know, the majority of pain medications, that's why people develop heroin addictions. It's because they can't come off. Okay. So they constantly want that high. They constantly want, I mean, if you've had surgery, you've probably taken pain meds or broken a bone or something like that. You've probably taken pain medicine. What does it do? It makes you pain free. It makes you, right? Okay. So, Dilaudid, that's a high-powered pain med, okay? Oxycodone, another one. Demerol, that's another one. Methadone. Methadone is what they put meth addicts on when they're trying to come off of meth. They put them on methadone. Have you ever heard of methadone clinics? Okay. Well, methadone clinics are when a drug user, somebody that's on meth or heroin, can go in and they say, hey, I want help. I want to try and get off drugs. Well, 99% of drug users like that, hard drug users, can't just quit. Okay? They go through DTs. It is horrible, 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 horrible. That could kill them, exactly. So they put them on methadone, which is a pill. Okay, it's an opiate. It's like a pain pill. And it helps them slowly wean off to where, you know, it's coming down safely. Does that make sense to everybody? Darvon is another one. Fentanyl is another one that is becoming increasingly popular, and a minute amount of fentanyl can kill somebody. You're having THC, pot. You're having it laced with fentanyl, and it's killing people. Y'all need to watch y'all a good episode of Intervention when they're hooked and stuff like this. It's sad, and you can hear them talk about all these, and it's crazy. But fentanyl is also, I mean, it's a pain medication also, but you know, it's given in certain amounts. They cannot give over a certain amount because it can kill you. When I had my hysterectomy and my pain was uncontrolled, they gave me fentanyl and Dilaudid and morphine. So I had all three of them. And y'all remember I come home, well, I don't know if y'all wasn't with me, but I told y'all about it. I come home and I didn't have, they forgot to give me my pain pill prescription, like my oxycodone prescription. And I'm telling you, because I was on all that pain medicine, I was coming off and I was going through withdrawals. My whole body hurt. I had a headache for over a week. My bones hurt. And I was like, I thought it was something to do with anesthesia and or my surgery. And it wasn't. I was coming off the drugs that they gave me for pain. And I'm really glad that they did not give me my prescription for my oxycodone. Because what do you do when you're in pain if you have a prescription? Take a pain pill, right? Well then, what do you do when that pain pill wears off? Take another one. That's how people get addicted to drugs. Okay. And I'm not saying that I would have done that, but I could see how easy it was to get addicted because I was in pain. But I'm the type of person, I don't have an addictive personality and I fought through it. That's just the difference in me and some people. You know, some people don't have that. Anyway, go to the next paragraph. Laboratory testing for opioids usually involves initial screening by immunoassay. And then if you go down a little bit more, GCMS is the method of choice for confirmation testing, and LCMS has become more prominent. Tricyclic antidepressants, we just talked about them. They're used to treat depression and mood disorders. Imipramine was the first used for depression. Go down a little bit more, like 5 lines. Amitriptyline is another one. These are not your Zoloft and stuff like that. Okay, like your regular antidepressants, your Zoloft, your Lexapro, stuff like that. This is not this. It's TCAs. It's totally different. If you go down to the next paragraph, 6 lines down, 5, 6 lines down, commonly prescribed to treat depression, TCAs are commonly used in suicidal attempts. They block the reabsorption of serotonin and norepinephrine, increasing the levels of these two neurotransmitters in the brain. So that's why it's in a drug of abuse category. That's because people try to commit suicide. Methyl N-dioxymethamphetamine, MDMA. MDMA is an illicit amphetamine derivative commonly referred to as ecstasy. No, just no MDMA. Okay. You do need to know how to spell tetrahydrocannabinol, but not MDMA. Although it was strongly associated with club culture in the 90s, its use has continued to grow. Go to the next paragraph. The onset of effects is 30 to 60 minutes and duration is 3.5 hours. Desired effects include hallucination, euphoria, empathetic and emotional responses, increased visual and tactile sensitivity. So has everybody heard of ecstasy before? It makes you see things and makes you feel like you're in another world, like you're tripping. Like you've heard the expression "I'm tripping." Was kind of like, I mean, I don't know, I've never taken MDMA. Yeah, 21 Jump Street. Have you ever seen that? Okay. No, it breaks it. It makes you. Yeah. Phenylcyclidine. PCP. Phenylcyclidine. PCP, you do need to know how to spell this. It's known as angel dust. It's an illicit drug with stimulant, depressant, anesthetic, and hallucinogenic properties. So at first it brings you up, then it brings you down, okay? And you hallucinate with it. It's called angel dust. Go down three lines. Subjective effects include agitation, hostility, and paranoia. PCP can be ingested or inhaled by smoking a PCP-laced tobacco or marijuana. Anabolic steroids. They are a group of compounds that are chemically related to male sex hormone testosterone. So everybody's heard of steroids, right? Taking steroids to pump you up. Okay, that's what this is. Next paragraph. Most illicit steroids are obtained through the black market from underground labs and foreign substances. Pretty much it on that, and that's this chapter. However, I do want, let me write this on the board. So, let me show you this. So you have different types of drug panels. So you have like a drug panel 7, a drug panel 10, so forth, so on. You can do it in cups. You can do it in like a kit test like thing, which I'm about to show you. It's called a triage. Maybe. So kind of looks like this or whatever. So you'll put the urine in here and then it comes up, and if most of the time, if it's pollen, it'll have a line. There's stuff like that. Or like Swainsboro, they don't have the cups. You put it on your chemistry analyzer and go from there. But I want you to know what's in it. Usually is like a 7 drug panel. And you're gonna have to list these on your test. So it's actually the triage drug panel. And it's for drugs of abuse. Barbiturates, benzos. Tetrahydrocannabinol, THC. Encyclamine, which is PCP. Opiates. Cocaine. Amphetamines. So, this is just a 7 panel. Like I said, there's 8 panels, 9 panels, 10 panels, so forth, so on. The amphetamine, so let's just say a person was on meth, okay? Some, like other panels, will break down amphetamines and amphetamines separately. But this one in particular puts amphetamines in a category by itself. And so if you're on any type of amphetamine or if you were on methamphetamine, it will pop up under amphetamine. Barbiturates,
Whatever. It's not an A or a,
OCY,
oh, see what?
yeah, sorry, they're benzyclidine. Sorry. So barbiturates are like your phenobarbital. Benzos are for like anxiety. So that would be for Valium, your Xanax, stuff like that. THC, y'all know what that is, weed, okay, marijuana. PCP is painkillers. Opiates is your pain relievers. Cocaine